COVID-19 update, field awareness training. Program overview. This program is designed to be an awareness level training for our field employees on Fessler Bowman job sites. This training will be organized along the NIOSH hierarchy of controls. Participants will learn about COVID-19 symptoms, spread and outcomes, the regulatory requirements, risk assessment and our site-specific exposure control plan, basic infection prevention measures at the job site, and the purpose, use, and limitations of personal protective equipment, or PPE. Module 1, SARS-CoV-2, Basic Facts and Symptoms. COVID-19, or coronavirus disease 2019, is a severe acute respiratory disease characterized by symptoms including fever, cough, fatigue, and shortness of breath, which may progress to pneumonia, multi-organ failure, and death. This illness is caused by exposure to the SARS-CoV-2 virus and its variant strains. The impact that the virus has on an individual can range from minor or no symptoms to serious illness and/or death. The definitions shown here are important to understand as they relate to the implementation of our preparedness and response plan. Close contact. Someone who is within 6 feet of an infected person for at least 15 minutes starting from 2 days before the illness onset or from an asymptomatic person 2 days prior to the specimen collection, until the time the person is isolated. The time frame described here is important for determining when to start the clock for isolation, testing, and return to work following isolation. Suspected case. Persons who have symptoms of COVID-19 but have not been confirmed through diagnostic testing, or persons who have had close contact with a person who has been confirmed through diagnostic testing. Known case of COVID-19. A person who has been confirmed through diagnostic testing to have COVID-19. As many of us have heard through the various media outlets, there are several variant strains across the country that are causing the case numbers to rise in certain regions. The strains identified here are the most common strains that are being tracked currently. The variant strains include the B.1.1.7 or UK strain, which was discovered in September of 2020. It spreads more quickly and easily than the other variants, and it also has an increased risk of death. The B.1.351 or South African strain was discovered in October 2020. While more easily spread, it does not have a change in the disease severity. The P1 or Brazilian strain was found in the US in January 2021. Individuals may be able to catch this version more than once. Early studies have found that antibodies may not be as effective against this particular strain. The map shown here is available through the CDC and demonstrates where the variant strains are creating hotspots. This particular representation of the map has the UK variant filter selected. As we move through the vaccination process, it's important to note that the vaccines each have differing levels of effectiveness on the variant strains, so it's important that we stay diligent about our protective measures to help prevent the spread of these variants from region to region. In this case, the UK strain is more easily spread than the original virus, and case counts are rising in areas where this particular variant is common. What about the vaccines? There have been a lot of questions regarding the vaccines. Here are some important facts that you might not be aware of. First, the vaccines do not contain the live virus and cannot give you COVID-19. The vaccines are more than 95% effective in preventing COVID-19 after getting both shots. People are considered fully vaccinated 2 weeks after getting their second dose of the vaccine for the Pfizer or Moderna vaccines and 2 weeks after receiving the single dose of the Johnson & Johnson vaccine. But it's important to remember that it's only 95% effective, which means even if you get the vaccine, there is still a small chance that a person could get COVID-19. Lastly, experts do not know how long the vaccines will protect you from getting the disease after the vaccination. How do the vaccines work? Well, first, the COVID-19 messenger RNA vaccines are given in the upper arm muscle. Once the instructions are in the immune cells, the cells use them to make a spike protein piece. After the protein piece is made, the cell breaks down the instructions and gets rid of them. Next, the cell displays that spike protein on its surface. Our immune systems recognize that the spike protein doesn't belong there and begins to build an immune response and making antibodies. It's very similar to what happens in a natural infection. At the end of the process, our bodies have learned how to protect against future infection. The benefit of the mRNA vaccines, like all vaccines, is that those vaccinated gain this protection without ever having to risk the serious consequences of getting sick with COVID-19. What about the vaccines? The CDC has released the guidelines shown here for post-vaccination outside of occupational settings. It's important to remember that the OSHA rules still apply to the workplace. So looking at the Choosing Safer Activities infographic that's been released by CDC, you can see that in the right column, we have a series of diagrams or pictograms that show fully vaccinated people with and without masks. And on the left side, we have unvaccinated people with varying shades, so low, medium, and high risk, folks that are both in and outside of masks. So if you're fully vaccinated and you're outdoors, for example, you can walk, run, or bike outdoors with members of your household, attend a small outdoor gathering with fully vaccinated family and friends, and then in this one, this is the first one in the left column, you can see where an unvaccinated person would have to wear a mask, and a fully vaccinated person, all the way to the right, would not have to wear a mask. You can attend a small outdoor gathering of fully vaccinated and unvaccinated people. So the diagram that you see here in the presentation in your handouts is linked. So if you click on it, it will take you to this take you to this document so that you can see what you can and cannot do. But remember, this is a public health document and applies outside the workplace. So we still have to comply with the general provisions that both OSHA and in case of Michigan, MyOSHA put into place for our workplaces, at least until further notice. Post-vaccination considerations for workplaces. According to the CDC, employers should still continue to follow the guidance for businesses and employers responding to COVID-19. Regionally, some states have issued additional guidance for workplace safety. For example, on April 14th, 2021, Michigan extended the existing MyOSHA emergency standards for workplaces until October 14th, 2021. Other states have begun to enact permanent workplace restrictions when dealing with COVID-19 and other airborne infectious diseases. Current CDC guidance for workplaces. So in the previous slide, we looked at the CDC guidelines for fully vaccinated people, and it's important to remember that those apply in non-occupational settings. So as a summary of the recent changes, and this is as of April 27th, 2021, CDC has released guiding principles for fully vaccinated people, underscores that immunocompromised people need to consult their healthcare provider about these recommendations, even if fully vaccinated. There is still a small percentage, about 5% chance, that a person who's been fully vaccinated could still be exposed to and contract COVID-19. Fully vaccinated people no longer need to wear a mask outdoors except in certain crowded settings and venues. So generally speaking, if you're in a public venue where there's a mix of opportunity to be within 6 feet of each other and their potential for exposure for people who are not vaccinated, then masks are still required in those types of situations. Clarification that fully vaccinated workers no longer need to be restricted from work following exposure as long as they're asymptomatic. We will continue to follow the OSHA and MyOSHA workplace specific guidelines for how we deal with exposures and our local health department requirements. So even if you're asymptomatic, because not everybody at this point is fully vaccinated, we still have to concern ourselves with the potential for spread within our workplaces, so we will continue to err to the side of caution on that. Fully vaccinated residents of non-healthcare congregate settings no longer need to quarantine following a known exposure. This particular point doesn't apply to us. We don't deal with things in those settings. Fully vaccinated asymptomatic people without exposure may be exempted from routine screening if feasible. There's no way to really detect asymptomatic people. Basically, that means that you have an exposure, but you're not showing any symptoms. So to help prevent the spread in our workplace, we will still comply with the OSHA and MyOSHA workplace-specific guidance, which includes the health screening process at the upon entry into the structure, and then anybody who has had an exposure in terms of return to work type testing after an isolation, we will still continue to follow the workplace-specific guidance, not only from OSHA and MyOSHA, but also from our local health departments in those areas where there may be high community transmission for the variant strains. Module 2, Regulatory Requirements under OSHA. General duty. There are currently no OSHA-specific regulations that deal with COVID-19 and other health emergencies for communicable diseases. OSHA is currently enforcing COVID-19 prevention measures under the Occupational Safety and Health Act's General Duty Clause. The General Duty Clause states that employers have a responsibility to provide employment and a place of employment that is free from recognized hazards that are causing or are likely to cause serious physical harm or death. COVID-19 is a recognized hazard in all industries. Degrees of risk vary according to the work performed. We will discuss risk categories in the next section. OSHA enforcement. With the change in the executive branch came a presidential order issued on January 21, 2021, to emphasize the measures needed to quell the spread of the virus and the resulting COVID-19 illness, while ramping up the availability of vaccinations. As a result of the presidential order, OSHA launched a national emphasis program targeting industries that have high exposures to COVID-19 in the workplace. This emphasis program began on March 12, 2021. Secondary target industries for the National Emphasis Program. As part of its emphasis program, OSHA has identified the construction industry as a secondary target industry. OSHA has also indicated in the emphasis program that they will be increasing the number of on-site inspections in both the primary and secondary target industries. The list of industries shown here is only a partial list taken from the National Emphasis Program directive. Specialty trade contractors were identified as a secondary target industry. What will OSHA be looking for? Well, in Appendix E of OSHA's National Emphasis Program, they identify in their letter to industry the items from the CDC guidance page that OSHA will be enforcing. The CDC recommends that employers take the following steps to prevent the spread of COVID-19. Use of face coverings or masks throughout the workplace, actively encouraging sick employees to stay at home, accommodating employees through social distancing or telework if possible, emphasize proper respiratory etiquette and hand hygiene by all employees, and to perform routine environmental cleaning. OSHA also expects that employers will do the following to stay informed about changes to both policy and evolutions in the science. Check with governmental websites such as CDC, State Department, and monitor for any travel advisories where applicable. And 2, plan for infection disease outbreaks in the workplace. To date, OSHA has written over $4,034,288 in citations to employers in various industries for general duty violations. These citations will continue even though we are seeing some states eliminate their mask mandates. Politics aside, as an employer, we must ensure that we are taking the necessary precautions to protect our employees from exposures that we have the ability to control. Penalties have ranged as high as $32,000 for employers who have blatantly disregarded these principles. The list shown here is a high-level representation of the items that we must implement as an employer for the prevention of the spread of COVID-19 in our offices and our work sites, and include development of a COVID-19 preparedness and response plan, including a health screening questionnaire, the designation of a COVID-19 safety coordinator for each work site, requiring masks when social distancing cannot be maintained or when in shared spaces, implementing enhanced hygiene practices for the workplace, and training employees on the hazards and safeguards for COVID-19. Module 3, Risk Assessment and Exposure Control Plan. Risk Assessment. OSHA requires that we classify our workers' risk exposure as part of the development of our preparedness and response plan. OSHA has identified 4 levels of risk exposure: low, medium, high, and very high. Fessler Bowman has determined that our field operations fall into various risk categories based on the OSHA definition for each risk level. Lower exposure risk. OSHA defines a lower exposure risk as jobs that do not require close contact with other people. Workers in this category have minimal contact with the public and other coworkers. Fessler and Bowman examples include remote workers workers that do not have frequent contact with coworkers, customers, or the public, or when working outdoors while maintaining social distancing. Medium risk exposure. OSHA defines medium risk exposure jobs as jobs that require frequent close contact or sustained close contact with other people in areas with community transmission. Fessler Bowman examples include meetings between two or more parties in shared indoor spaces for durations of less than 15 minutes while maintaining social distancing and wearing masks. Examples would include job trailers or offices. Another example would be frequent contact with the public in outdoor or well-ventilated areas or outdoors during close working conditions, such as finishing concrete or performing forming work. High-risk exposure. OSHA defines high-risk exposure jobs as jobs with a high potential for exposure to known or suspected sources of the SARS-CoV-2 virus. Fessler and Bowman has some work activities that would qualify for this exposure currently. Examples include job site meetings where there is sustained close contact, and job trailers where social distancing is not possible, where it's poorly ventilated, and masks must be worn. Meetings between two or more parties in an outdoor shared space longer than 15 minutes with social distancing and masks, and while working within 3 feet of another without masking outdoors, such as working in a lift, pouring concrete, etc. Very high risk exposures. OSHA defines very high risk exposure jobs as jobs with very high potential for exposure to known or suspected sources of the SARS-CoV-2 virus during specific medical, post-mortem, or laboratory procedures. Fessler and Bowman does not have any work in this risk category. Preparedness and response plan. To protect our employees, Fessler and Bowman has developed a preparedness and response plan available through a variety of resources, including the Bamboo portal, the F&B application, a QR code scan, by request from your job site COVID safety coordinator, and during training. The Preparedness and Response Plan includes the measures that Fessler and Bowman has implemented to help control the spread of the virus in our work operations. In the next section, we will be discussing specific exposure controls. It is important to note that even with stringent exposure controls, it is possible to contract and spread the SARS-CoV-2 virus, which can result in the COVID-19 illness. The methods described in the next section are only effective when conscientiously applied by employees adhering to the policies. Limiting the spread of the virus is a team effort. What does the plan include? The Preparedness and Response Plan includes a variety of protective measures and responsibilities that must be implemented according to the safe workplace measures established by both OSHA and the Center for Disease Control. The Preparedness and Response Plan describes the procedures that Fessler and Bowman has implemented for each of the bulleted items listed here, including employee and management responsibilities, symptoms of the virus, the designation of a COVID safety coordinator for each site and branch location, exposure determinations, health screening provisions, workplace protective measures for office and field operations, reporting and isolation procedures, employee notifications, training, and the necessary record-keeping requirements, including contact tracing. Module 4, Infection Control Methods. Health Screening Questionnaire. All employees must complete the health screening questionnaire prior to being admitted to working at the job site. The health screening questionnaire helps to limit exposures, but is not effective at catching asymptomatic carriers of the virus who may not show any symptoms. Because of this fact, the other preventative measures described in this section must be effectively implemented to help prevent the spread of the virus on our job sites. As a specialty subcontractor, we often perform work on multi-employer work sites where it is essential that COVID-19 prevention programs are coordinated amongst several employers. This means that in a lot of cases, you will have to participate in the site-specific health screening for a particular job site. COVID-19 Preparedness Inspection. At least once each week, the COVID safety coordinator or the job site safety representative will perform an inspection of the job site to assure that the COVID-19 prevention measures are being effectively implemented and that adequate supplies are available to maintain sanitary conditions on the job site. The inspection will verify that social distancing and masking policies are being adhered to. This inspection will be documented in Procore utilizing the inspection template shown here. Masking policy. Wear at least a two-ply cloth face covering made of tightly woven, breathable fabric, such as cotton, that does not have exhalation valves or vents while in common areas and when social distancing cannot be maintained. Face coverings reduce the transmission of respiratory droplets or aerosols from person to person. All Fessler and Bowman employees will adhere to the masking policies in place at the job site or the Fessler and Bowman policy. While masks have been highly politicized, they are required by OSHA when social distancing cannot be maintained or whenever in areas that are likely to increase the spread of the virus. Social distancing. Practice social distancing by maintaining 6 feet of separation from other people, especially while indoors or in poorly ventilated environments such as job trailers, field offices, hallways, and break areas. Face coverings are required anytime that social distancing cannot be maintained indoors or outdoors. Ride sharing is also strongly discouraged for this reason. Disinfecting your workspace. Use disinfecting wipes to sanitize commonly used items twice daily. Items such as tools, phones, tablets, keyboards, equipment controls, and door handles are all good candidates to be wiped down. Anything that you are sharing from person to person should be wiped down prior to sharing it with another individual. Disinfectants. Bleach solutions. We always want to make sure that we follow the manufacturer's applications for the bleach solutions that we're going to be using. If there are no instructions available on the bottle, leave the diluted bleach solution on the surface for at least 1 minute before removing or wiping. This is known as the contact time for disinfection. The surface should remain visibly wet during the contact time. Ensure proper ventilation during and after application, such as opening a window or putting a fan in place. Never mix household bleach or any other disinfectant with any other cleaner or disinfectant. This can cause vapors and may be dangerous to breathe in. Make a new diluted bleach solution daily. Bleach solutions will not be as effective after being mixed with water for over 24 hours. Always follow the manufacturer's recommendations for the mixing of the solution, or you can utilize 5 tablespoons or 1/3 cup of bleach per gallon of room temperature water, or 4 teaspoons of bleach per quart of room temperature water. But remember, it loses their effectiveness after 24 hours, and a new bleach solution should be made daily. Cough and sneeze etiquette. Additionally, even while masked, it is important to follow basic cough and sneeze etiquette to help prevent the spread of respiratory droplets to nearby people or surfaces. When coughing or sneezing, turn away from anyone near you. Always cover your mouth and nose with a tissue, and when you cough or sneeze, use the inside of your elbow and do not spit. Throw used tissues in the trash, and then immediately wash your hands with soap and water for at least 20 seconds. Module 6. Personal Protective Equipment, or PPE, Purpose, Use, and Limitations. Respiratory protection during the COVID-19 pandemic. Users of respiratory protection equipment must understand the purpose, use, and limitations of the various types of protective equipment utilized for protection against the SARS-CoV-2 virus. Failure to understand the proper use of these devices can lead to exposures. Each of the levels of protection will be described in the following slides. Face masks versus respirator. Surgical masks. A surgical mask is a fluid-resistant barrier designed to protect user and others from large droplets, splashes, or sprays of bodily or other hazardous fluids. Rating. Cleared by the U.S. Food and Drug Administration per 21 CFR 878-4040, which is a regulation. Limitations. It's not classified as a filtering facepiece respirator to protect against inhaling smaller airborne particles. It is a loose-fitting seal allowing leakage around the edges of the mask and is not designed for reuse. So these items are single-use items that should be changed every time we use them. It's not something that we should be hanging from the mirrors in our cars or using for days on end. When we take it off, we throw it out. It's not designed to be used for long-term protection. Cloth face coverings versus respirators. Two-ply cloth covering. Purpose is to prevent the transmission of the virus between people in close proximity. It's not tested or approved, but currently recommended by the CDC. The limitation is that it is not classified is a filtering facepiece respirator to protect against inhaling smaller airborne particles. It has a loose-fitting seal, allowing leakage around the edges of the mask. The benefit of cloth face coverings versus a surgical mask is that these can be laundered and reused. Again, it is something that if you're going to be using a cloth face covering, you should be regularly changing that face covering. For example, you should be wearing a different cloth face covering each day of the week. If during the course of the day you're wearing your cloth face covering for an extended period of time and it is becoming damp or soaked because of respiratory droplets and just breathing in general, it should be changed. Filtering facepiece respirators, or N95 respirators as they're more commonly known. The purpose of an N95 respirator is to protect users from monodispersed particles of around 0.3 microns or larger in the respirable breathing range for particle size. The 95 means that they're 95% effective at controlling those particles. A more restrictive version or a more effective version would be a N100 or a P100 version of the same respirator. All respirators are rated and approved by NIOSH for use in an occupational setting. The limitation of tight-fitting respirators like the one shown in the picture here are that they can impose restrictions on a person's ability to breathe. Users should be medically cleared to wear a tight-fitting respirator. Resources: Federal and state COVID-19 response pages. The following slides will briefly display QR codes for the federal and state specific resource pages. These websites are updated regularly and are a great resource for up-to-date information on what is happening with the policies, procedures, and local statistics relating to the SARS-CoV-2 virus in your area. These resources are available in the handouts for this program.